What's up, you guys? My name is Miguel, fellow Xray Tech Peep here, giving you the knowledge you need. So, we're covering today ICU, which stands for Intense Care Unit. So, this part of the department is where, the patients are in there pretty bad. Not gonna lie, from what I've seen, COVID has brought in a lot of patients to be up there on vents, and they need a lot of support, nurses, and basically the most type of stuff connected to them. So that department right there especially has a lot of morning portables. If you do nighttime, you will have the X-ray up there, or you'll have a lot of codes, or you'll have a lot of things. So you will be up there. Sometimes. Let's see what else. So when you go up there, where our facility is, it's kind of tight. There's not that much room to get in your portable, so you had to sometimes be creative or be able to park and maneuver and stuff. And once again, they are hooked up to vent most of the time, or they have a lot of things, or they'll be COVID positive. You always have to bring a mask. N95. You have to work around stuff. So if you go, you and another tech, it's usually easier because one can pick up, or you can both pick up on one side of the board and do stuff like that. Or if you go by yourself, try to ask a nurse or someone else who's in there, mainly for bigger patients and stuff like that. Because some of the patients are conscious, and you talk to them and they'll be able to move, and other patients they can't. They're too weak. You don't need the help. And then some of them are they're special needs, and they're I think it's called the Truman Smith type kids. You have to talk with them, try to work around, or there's certain exceptions. All depends. Sometimes there's traumas. Not traumas. Codes that come up there, and it gets a lot of chaotic up there. A lot of nurses and everyone else running around, and you try to slide in, squeeze in, try to get your X-ray. For the most part, it's not that bad. It's kind of hard if you're a tiny tech and you're short, because sometimes they'll be heavy. I'm 6 foot and 300 pounds. Go to the workout. It's not that hard to maneuver patients that much, but certain other techs, they're skinnier and can struggle up there. But sometimes it does suck when you have a patient that's 600, 800 pounds, and they're we're gonna do an X-ray on their chest, and you're just I'm by myself, and there's no nurses, no one else to help, so you kind of have to work around stuff like that. And sometimes they'll order stuff on a 600 to 800 pound patient. They're we want a KUB, and you're if I shove my board down there, it will break or overheat. And most digital X board, you're looking something $100,000. We had a few of them break in our department, and they're not that happy. So you always got to be careful with that. Know your limit on your board, especially if the patient's dead weight or they can't move and stuff like that. And yeah, that kind of summarizes it in a nutshell. Yeah, see you in the next one.